the piece you wrote in the Wall Street Journal last Thursday, which is still linked at our website, Obama's Health Rationer in Chief, was the single most stunning piece about just about any topic I've read in my adult life, Dr. McCaughey. And I'll do in 15 seconds or less, the 5 theses, and I'm leaving some out, so please feel free to go to others. But the 5 theses that I've shared with people are that the guy who's actually in the White House, who's making these decisions and who will make more if they're successful, is a guy who says the Hippocratic Oath is bad because it's causing doctors to overuse medical care.
Okay, let's start on that one.
Go, sure.
Because I actually was on an NPR station this morning with Brian Lehrer in New York City.
Yes.
And I was explaining that my concern that doctors were going to be pressured to modify their commitment to the Hippocratic Oath. And believe it or not, this talk host thought that was a great thing, that doctors should not focus entirely on the needs of their own patient, but should serve two masters, the patient and society as well. He actually found it very acceptable and thought that I was too demanding to think that a doctor should focus only on the needs of his patient.
For people who don't know it, in 10 words or less, the Hippocratic Oath essentially says, as a doctor, I will do all I can to make this patient better. Yes?
That's right, that I will devote myself with no attention to anything else, to use my judgment and resources to make this patient better. And what Ezekiel Emanuel is arguing, and he's done it actually in more than one article, he said, look, doctors need to focus less on the needs of their own patient and more on broader social issues, basically asking, should I be spending these resources on this patient, or are they better used somewhere else? Now, we all want our doctors to focus on us. That's the trust between a doctor and a patient. And the doctors have always been trained to believe that they achieve social justice one patient at a time.
Yeah. Given our limited time, let me go right to the second. I don't want to bury my lead. I found the 2 most shocking things you uncovered were the one you've just addressed, which is Emanuel's assertion that the Hippocratic Oath is bad and is responsible for the wrong kind of healthcare. The second one has to be his introduction, or your unearthing and reporting of his declaration here of this full life service deal where he sees the range of investable life being above the age of 15 and below the age of 40, and actually goes on, as you've uncovered, talking about how it's not that big not that big a deal when an infant dies, because after all, we haven't really invested in that infant yet. This is stunning stuff to come from in America.
Yes, but actually I wanted to move to another paragraph because you're talking in one of the most important medical centers in the nation. Many people come to hospitals in the Boston area to be treated for cancer. And one of the proposals that Dr. Ezekiel Emanuel has put forward, believe it or not, in the context of health reform, is that insurance companies should be less generous in paying for cancer drugs. He argues that if a cancer drug has a median a success rate of adding only 2 or 3 months on average to a patient's life, it shouldn't be paid for. But as everyone who's been in a healthcare situation like that knows, the median is just the average.
Yes.
It means really that perhaps 20% of the people who take that drug are able to beat the cancer and go on and live again.
And Dr. McCaughey, I don't mean for the world to insinuate, I really don't insinuate anything political here at all, just by virtue of the fact, though, that the invoking Teddy Kennedy's name makes it seem so. Here is we've just finished here in Boston, in other parts of the nation, but here in Boston, mourning this beloved public figure who, by virtue of the kind of health care that you and I oppose here, he might not have lived as long as he did. Do people not see this irony here, this contradiction?
That's right. And I want everyone to have access to those cancer drugs. What is missed when you say, why should we pay for a cancer drug that adds only, on average, 2 or 3 months to a patient's life? Chemotherapy is a guessing game. And when patients have exhausted the proven remedies, a given chemotherapy drug may work only 20% of the time, but you want to try it. And it's important to be able to take that drug because 20% of the time it might give you life back. So we can't tell insurance companies they shouldn't pay for these drugs because it will save money.
Dr. McCaughey, what is there a web address now that we can continue to follow for your contributions?
DefendYourHealthcare.us.
All right, so it's the same one. We've been announcing it for weeks. We have it on our website, DefendYourHealthcare.us.
Right. I did want to bring up one other
Please
issue,
do.
if we have time.
Oh, well, my time is yours.
And that is that this health reform in Washington, I shouldn't use the word reform, this health legislation that's being put forward in Washington, which has some good aspects to it, covering the uninsured, reducing some of the abuses found by insurance companies, but it's paid for with a $500 billion cut in future Medicare funding over the next decade. That's a 10% cut when 30% more people are going to be enrolled in Medicare. That means fewer hip replacements, fewer knee replacements, fewer bypass surgeries. And these are the procedures that have enabled older people to conquer the disabilities of aging, like crippling arthritis, and really enjoy their later years.
Yes, indeed.
We can't do that to them.
I notice you write that Ezekiel Emanuel wrote, quote, vague promises of savings from cutting waste, enhancing prevention and wellness, installing electronic medical records, and improving quality of care are merely lipstick cost control, more for show and public relations.
Yes, and that whole comment seems so cynical to me because what it admits is we're not going to tell you what the real cuts will be. And that's what we have to stop. We have to make sure that the seniors are not punished by this health reform movement. And under the current legislation, they bear the brunt.
You are, in closing for this occasion, let me ask you, you know an awful lot about politics and have lived in it and done it for a long time. Do you sense that there's any shift here? You sense any shift in the momentum?
I'm not sanguine yet. And, you know, we're all waiting for the amended Senate bill, which should have been available for those of us who want to read it a while back. But they're keeping it under wraps. How can we have a national discussion about health care legislation if they won't show us the new bill?
I think the answer is the question.
Right.
Dr. Betsy McCaughey, thank you so much.
So nice to join you.
Pleasure to hear you again. I hope you will come back and see us soon. Dr. Betsy McCaughey, she is the most learned, I'll say opponent. I don't know if she'd use that characterization, but she is the most learned public source for knowing about Obama medicine, and it is a shocking article. Really, it's the most powerful and stunning single piece I have seen that I can ever recall. It ran in last Thursday's Wall Street Journal called Obama's Health Rationer in Chief. That title doesn't begin to do it justice. And you should really read it, and you should share it with others. I have. I don't like to push these things on you, but I shared it with everyone who would listen since the day this thing was published. Dr. Betsy McCaughey's piece, it's at our website, 96.9 WTKK. I'll be right back.
Thanks for downloading and listening to Jay Severin. Come back often. Boston's Talk Evolution 96.9 WTKK is online and on demand.